Since we are approaching the 5th year anniversary of Hurricane Katrina, this is obviously a relevant time period to talk about where the city is 5 years since the storm. As a native New Orleanian and as someone who's lived in the city of New Orleans my entire adult life, with the exception of college and law school, I think that the city has come a very long way in the 5 years since Katrina occurred on August 29, 2005. I never anticipated 5 years later that the population of New Orleans would be where it was. I never anticipated that a number of the neighborhoods that were completely flooded in the city of New Orleans would be back. I never anticipated that many of the schools that were in the condition they were immediately after the Katrina, including churches, etc., would be in the position that we are. So I think that the city has much to celebrate, and the citizens of the city have much to celebrate about where we are. But it is important for us to be realistic about where the city is. And first of all, always keep in mind that over 2,000 of our fellow citizens lost their lives as a result of Katrina. Also keep in mind that many people lost their homes and every single possession that they had as a result of Katrina. And one of the things that I was very focused upon in working with the Bring New Orleans Back Commission, as well as working with the Louisiana Recovery Authority, was the condition of health care for all citizens of the city of New Orleans after Katrina. I am disappointed that we're not a little further along as it relates to building the academic medical facility in the city of New Orleans. I believe that our citizens deserve it. I think that it's time for us to really move forward with that project, and it's important, if we are going to have a vibrant city, that we have that facility built in conjunction with the VA hospital. So one thing that I'm hoping to see come to pass is that we start making very significant progress as it relates to the building of the hospital, and based on the fact that the current mayor has committed to building a hospital in New Orleans East, that be done as expeditiously as possible, such that the citizens of New Orleans East have access to health care. Health care is clearly one of the most critical things that impacts anyone in this country, but particularly the citizens of the city of New Orleans, because we're dealing with people with not just physical problems, but mental health problems, and we have to continue to focus on and encourage people to really try to do preventative medicine. So that's where we are, and I'm looking forward to our city continuing to improve.